Arizona continues to struggle with the devastating impact of the opioid epidemic. In the last year alone, more than 16 million people misused prescription opioids. Yet only 17% of employers say they're prepared to address opioid use in the workplace. Today, a person is more likely to die from an accidental opioid overdose than a car crash. We know this issue touches every corner of our state, and that includes where we work. The cost of this crisis to the Arizona economy exceeded $53 billion in 2022 alone.
So what's being done to address the issue? The wider distribution of naloxone is helping first responders, schools, and even businesses respond immediately to overdoses, and most importantly, save lives. There's an increased awareness about medically assisted treatment, also known as MAT, to help support long-term recovery. And statewide campaigns are increasing awareness about opioid addiction, reducing the stigma around asking for and getting connected to help.
We've seen positive momentum addressing the opioid crisis. The CDC data shows a 24% decrease in U.S. drug overdose deaths from October 2023 to September 2024, thanks in large part to widespread naloxone availability. And employers are beginning to have real conversations with their teams about mental health and substance use. Many are now reviewing policies, updating benefit presentations, and prioritizing building more supportive and recovery-friendly workplace cultures.
But why aren't we seeing quicker results? Stigma remains a major barrier that prevents people from speaking up or seeking support. We see this in the numbers. Only 25% of adults with opioid use disorder receive MAT for long-term recovery. People are still unsure how to help someone struggling with substance use. And while resources are available, many business leaders don't know where to start, or they feel overwhelmed trying to identify how to effectively help their employees.
We've seen some of these challenges unfolding. Opioid overdoses remain high, even as naloxone is helping prevent overdose deaths. Without upstream policies, companies face higher costs, safety risks, and employee turnover. Arizona has applied some Band-Aids, but we haven't yet invested in a holistic, comprehensive strategy to ensure all Arizonans have the resources to live longer, healthier lives.
So what's the solution? We need to empower employers with clear, actionable steps and show that supporting their team members with this chronic disease is good for business and the community. That means we must equip leaders to respond to substance misuse with confidence and compassion, integrate prevention and education into everyday workplace culture, and build partnerships that align business goals with public health outcomes.
That's where the VL Impact model can make real systemic and lasting change. Our model brings together business leaders, nonprofits, funders, and civic leaders together to leverage our connections, influence, and work so that we can increase awareness and understanding of the opioid crisis and create more recovery-friendly workplaces.
That's exactly what the VL Opioid Stigma Reduction Impact Team is doing. We created the Opioid Business Toolkit, a free, self-paced online platform for Arizona businesses to assess their current practices and build stigma-reducing policies and processes. We launched an AI-powered chatbot to help businesses get their quick answers to HR and policy questions. And we've shared our tools at conferences, collaborated with business leaders, and helped organizations start conversations that reduce stigma and build trust within their companies.
What's great about the VL Impact model is that it can be replicated and expanded. We've created a new model for how to address issues holistically and with systems change in mind. We're working towards a long-term goal, not just another Band-Aid.
Our biggest challenges can be our greatest opportunities to improve public health and workplace well-being. Reducing stigma and improving workplace readiness can prevent crises before they happen, creating healthier, more resilient teams across Arizona. By normalizing conversations around substance use, businesses can break cycles of isolation and help employees find connection, resources, and recovery. Helping an employee recover from this chronic disease saves on average more than $8,000 annually by avoiding turnover costs and lost work time. It's good for people and good for business.
The problem is big, but it's not too big to solve. It's about creating a transformational tipping point and new ways to ensure all Arizonans can live long, healthy lives. Want to be a part of this innovative model for getting things done? Learn more about our team's work at impactmakeraz.org.